All right, so welcome everybody to the Workgroup 5 Blueprint meeting, Maximizing Participation in Child Nutrition Programs. I'm Carrie Thielen. I'm serving as the chair of the Workgroup. So I'll just give a quick overview of the agenda and then we'll just go around and do some introductions because it looks like our group is growing and we have some new faces and we have some special guests. So, so today we're going to start out with following up to some action items from our last Workgroup meeting around promoting the summer food service program, and also talk through a governing council proposal that we are looking to submit tomorrow to the governing council. And then we're going to have the second half of the meeting. We have invited our evaluators from CDPHE who've been working on the needs assessment we've been talking about the last few meetings to share some of our preliminary data from our survey and key informant interviews. So to get started, maybe we can just, in consideration of time, maybe just say your name and the organization that you're representing. And we can start with Taylor.
I'm Taylor. I'm with Hunger Free Colorado.
And I'm Carrie. I'm with CDE.
Danielle Bach with Colorado School Nutrition Association and Greeley Evans School District 6.
Naomi Stinson, CDPHE, Child and Adult Care Food Program.
Megan Squires, USDA Food and Nutrition Service on the school meals team.
I'm Emma Kett. I am just kind of a community member and doing some consulting at the moment.
Keep passing this.
My name is Michaela Mullins, and I'm with Denver Urban Gardens.
Hi, I'm Carly Shaw. I'm visiting from New York, but I work on an educational farm there.
Deborah Cameron with CDHS Food Distribution Program.
Liz Gangweir with Jovial Concepts.
Christina Welch with Jovial Concepts. Julie Salerno with Food Bank of the Rockies.
Kathy Schmelter with Food Bank of the Rockies.
And I'm Kevin Warner. I'm with Trailhead Institute, which is the program office for the Blueprint. So if you have any needs, just let me know.
Kyle Sargent with the Colorado Health Foundation.
Good morning. My name is Octavio Maese with Denver Public Schools.
Abby Labe with CDPHE.
Shannon Lawrence with CDPHE.
I'm Gabby Warner with CDE, School Nutrition Unit.
Ashley Mullen with CDE.
Jennifer Banyan, I am with the Blueprint.
Rainey Wickstrom with the Colorado League of Charter Schools.
Great, and then we'll just go in order of everyone on the phone. So we'll start with Dee Matthews.
Can you hear me?
Oh, I can hear very quietly.
Okay. Is this better?
Yes.
Okay. This is Diane Matthews at Food Bank for Larimer County. I'm the programs coordinator, and I work with Lauren, who you guys might all know.
Megan?
Megan George Nichols with Child and Adult Care Food Program at CDPHE.
Okay. Jessica?
Jessica Wright with Live Well Colorado.
Kirsten?
Hey guys, this is Kirsten. I work at Share Our Strength and am filling in for Carolyn.
Erica?
Erica Edwards with Colorado School Nutrition Association and Jeffville Public Schools.
Stephanie?
Hey all, this is Stephanie Perez Carrillo with the Colorado Children's Campaign.
Alex?
I'm not sure if Alex, we can't hear you if you have it on mute, but it's Alex Erkenbeck. She is our data and evaluation analyst at CDPHE.
She doesn't have her microphone and stuff. She sent a message in the chat.
Patty Velasquez with the Family Resource Center Association.
And I'm Jackie Pines, also with the Family Resource Center Association.
Perfect. Thank you and welcome. We have a great group today. I just wanted to also thank everyone who has reached out with ideas for upcoming agenda. So feel free to keep those ideas coming and I'll make sure those are included in upcoming meetings. I'm also very open to feedback, and Danielle has provided some feedback today that she'd like to move a little more. So we'll have some wellness breaks in between so we keep it going.
Sitting is doing smoking.
Yes.
I heard that.
Okay. Yeah. So before we get started in getting into the summer meals outreach efforts of the Blueprint, I know there's a few people who wanted to just give some general updates. So I just want to open it up to anyone here who wants to provide any updates on some of the work that you're doing around supporting the Blueprint.
Okay, for those on the phone, this is Naomi Stenson, and I wanted to share some good updates. Recently, Jennifer Banyan connected us with Garfield County, where there are 2 school districts that operate on a 4-day school week. And there are some efforts going on to feed kids on the 5th day. Recently, we connected with the Public Health Department and an organization called Lift Up, and they are interested in signing up for the Child and Adult Care Food Program to serve other areas that they're not serving now. For example, libraries, but specifically at-risk after-school programs. So we're really excited to partner with them and look forward to sharing more with you in the future.
Congratulations, it's a big deal. We get it. Yeah.
Does anyone else have any general updates? Any legislation updates, anything?
No, Jessica here. I can update about some legislation.
Great.
So we have our 2 bills, the Colorado Food Systems Advisory Council. That one is a House Bill 1202, I believe. It made it through the appropriations and Senate and is now currently on the Senate floor, waiting for the 2nd and 3rd hearing before making it to the governor's desk. And that is to basically put in a full-time position at CSU, focused on supporting farm to school, farm to institution, and really helping to connect our local farmers and regional farmers as well with the institutions and help build up our food systems. And then our House Bill 1132, which is all about providing Colorado incentives for school districts to provide more local food, that has also passed out of the Senate appropriations and is currently on the floor as well for the 2nd and final reading of the Senate. So that's super exciting. The incentives would not become available until 2020 for that school year, but it is going to be a 3-year grant project, $500,000 in incentives, and it also comes with training and technical assistance, which would come into play for this school year to help really build up the skills of our school districts that are going for this grant so that they can start purchasing local items and do it with ease. So super exciting. I expect rounds of applause. It's been a big process. We're very excited about this and so close to it being almost done. I was kind of joking, but thank you. We are excited here.
Hi, everybody on the phone. This is Danielle Bach. I'll give you a quick update on HB 1171. The Lunch Protection Act should be being heard on the floor this morning, and I just texted our lobbyist, so if I hear anything during the meeting, I'll let you know. This bill will close the gap in the reduced meals eligibility category, basically eliminating the reduced eligible category in the state of Colorado. This bill will take us through the 12th grade for lunch, we already have full reduced protection for breakfast, so this will close that up. We will be feeding any student that is living in a household at 185% of poverty and below for free.
Danielle, yeah, great, awesome. When that bill, if that bill gets kind of stuck anywhere, a lot of times, especially last year before there were as many work groups, but I think especially now, there are a lot of people that would show up and make calls and that are kind of unlikely, not the same people that probably would have done these kind of calls. So health systems, elected officials that are those kind of elected officials. So if there are ways to leverage the partnerships in this room and then other work groups to show up or make calls, because this is a push that keeps getting shot down on for some reason, Hungry Teenagers just hasn't quite made it as a topic. Let us know, and we'll put the alarm bells out and get people there in a big way.
Absolutely, thank you, Jennifer. I think, and Stephanie, I'm grateful for your partnership with Children's Campaign, because they have been able to produce a fact sheet with, I don't know, 24 partners-ish signed onto it, including physicians and PTA and military, retired, Stephanie, you might be able to speak up, generals or colonels or something. I hate to default to this, but we passed out of the Senate Ed Committee last Thursday on a party line vote, 3-2, and so the expectation is we have the votes on the floor, it's going to go. There is always the possibility that we might be facing a third reading, but we really do think it's going to happen today on a second reading. So fingers crossed and think positively.
Oh, yeah. Just thank you for sharing the hunger resources last meeting. It was a pretty easy list to get those out to my networks and share them across the state and locally. So keep those coming. Thanks. Yeah.
Great. Does anyone else have anything else they want to share? Nope. Okay. Good stuff. Oh, yeah.
You all have probably seen by now, we sent out an email and press release, but Erin Ulrich from Prevention Services Division of CDPHE has been hired as the Blueprint Implementation Director. So we're really excited for her to get started. She'll start on May 20th. So.
Can I have one more, Carol? Yeah. So through the PD group, which is funded through the Health Foundation, there's going to be a hub launch, which is a place where all, hopefully, health and wellness resources will live, and it will require less trying to find and vet and share resources. So I'm thinking that all hunger resources related to our work in here would live there beautifully. So we want to be thinking about the hub as a place to both find and share really important resources for people to locate. That's happening soon, like in the next week or two will be the official launch of the hub.
Oh. Is there any instructions you could provide us on how to submit?
Absolutely, I can share all that with you. Yeah.
Okay.
So it's going to replace, hopefully, I vet through a number of resources I get, like newsletters, and I cull through and then I find the best, and then I share them out to across the state for charter schools. So it could save you folks a lot of time too, and maybe even reduce some duplication in your own organizations around creating newsletters, et cetera. Thank you. Sure.
Okay, so moving into the agenda, did everyone have a chance to review the governing council proposal? Yeah, I think it's also printed in your packet. So what we want to do today, this is a new process. I know the governing council is still working on what this kind of formal process will look like for work groups to present priority requests to receive funding around initiatives the work groups prioritize. So we quickly put this together, just the timeliness of summer meals and summer meals outreach, and then as a follow-up to what we discussed last time. So what I'd like to do is just open it up. Maybe I can go through a couple of the bullet points that we've included here as a review, and then just open it up and see if anyone has questions, if we're missing anything, if there's anything you want to add, so that we can prepare it for final review for the governing council tomorrow. So what we've included here as a collective group of Work Group 5 and as well as the Blueprint efforts as a whole, The actual funding request that we're submitting is to get site-specific signage, specifically yard signs printed for every summer meal site. So right now we have 93 summer sponsors and 641 sites, and we'll have those final numbers finalized in May, end of May. We did some pricing estimates of that, and it roughly, depending on where we go, it could be $5,000 to $10,000 based on the number that we end up with for the printing of the yard signs with stakes for every site. We still would need to work out the distribution, so I think we would need to look at mailing a little bit closer if this is something that's approved to go forward. I think there's other opportunities to save some costs around mailing, so CDE School Nutrition will be on site for TA visits and review visits, so that should be about a third of summer sites we'll get. A staff person will be on site so we could deliver those in person. And then potentially through, I think, work group efforts, we could also look at finding ways to deliver some of these. So I included here the CDE branded summer meal yard sign graphics, and they will be, are available in English and Spanish. Does anyone have any thoughts on that? Any questions?
Would one side be English and the other side Spanish? And I know I should have been able to blow it up on my computer. It'll have the texting where they can text and find their closest one.
I have a meeting with our communications people next Monday. Right now, how they say it is they just say join us for free meals and summer fun. Okay. So the yard signs don't include the additional site info, but we could add that.
Okay.
Are these the actual signs here?
Yeah.
Do you have a secondary level sign too? Is more high school age? You definitely bring elementary.
We do have graphics. I don't know if they were included in the yard sign. They might only be on flyers and postcards. But again, we could add another version if that would be needed.
Any other thoughts? And around the distribution of it, I was trying to think of if there's a central place people could pick them up, or just so we're not having to. We'll have to really drill down and see what the cost will be, how many sites that would really look like. But I was trying to think creatively on maybe some cost savings around that.
It may be a little late in the game by June 11th, but Colorado School Nutrition Association Summer Conference, that hits a bulk of the school sponsored.
Yeah.
So we could do that.
That's true.
How big are they?
I don't know.
How big are they?
18 by 24.
Oh, yeah. Got those the metal H that you push into the.
Yeah.
No.
Okay. Will they be removed each time, put any stay, or removed, or just left kind of?
Only for most signs, they, well, depending on where the site is, they'll pull them each day.
Okay.
What's the timeline to get them? Do you know?
That's a really good question.
No, we're just leaning in. Terry and I are going to sing.
I feel like we're on a radio show.
No, totally. Diane, I think you're on the call, but I believe that there's a Feeding Colorado training or conference coming up with all 5 food banks. I don't know when that is, and I don't know. I do know it's in Larimer County, but I don't know the date. Diane, if you could fill us in.
Yeah, can you hear me?
May 8th.
Yeah, I was going to say Food Bank of the Rockies, and they probably know too, May 8th, and it'll be at our facility or in Loveland.
That's next week.
May 8th. It is. Yeah, next Thursday. Or
Mr. Prince pretty quick.
probably following Thursday.
So that's,
Just 2 weeks from today.
I mean, as far as timeline and Blueprint team governing council, if you have any insight, but so it sounds like if this is an agreement that this is something we can move forward to, we'll just quickly turn around and you know, pull the numbers and go. I don't know if there's any logistics I'm not aware of as far as these requests.
As far as the agenda is concerned, I don't think that it's going to be a lengthy discussion.
Okay.
For the governing council. So they're going to be meeting tomorrow, and yeah, this is definitely on the agenda. And so they have some discretionary funding to be used during the planning period right now, which would be perfect for something like this. So we're hoping it will be a quick approval. So we should have more information as early as tomorrow.
Okay. And then we can talk, I guess, logistics on what that looks like, who would be doing the ordering and things like that, I suppose. Yeah, okay. Any other
I've
thoughts?
got a question. Is this just for each site? So basically one sign for each site, like in the front, or?
Yeah.
Okay.
Mm-hmm.
I'm speaking for Octavio a little bit, but I know DPS is having their big meeting on the 29th with all their institution teams. That's next Monday. So I don't know, Octavio, what you think about that, if that's a possibility, but.
As far as distributing?
Yeah.
I mean, it would be a possibility. We would have to have the signs by Monday, the 29th.
Yeah, very quick.
But,
They're
we could figure out a way to distribute them from our central office. I mean, we can work with y'all. It's possible.
Yeah, that'd be great. I know we're a proactive group, but I don't know if we can do it by Monday.
Was the idea to have them delivered here and then distribute them to the individual providers?
I don't know. I mean, I think because there's a lot of folks here who are running the summer program that we could, you know, distribute those amongst the group and give them directly to you so we don't have to mail them.
Yeah, absolutely.
But I don't know if there's another, I think we'd have to really sit and look at it to see if there's another way we could have, just promote that you could come to this place and pick them up, or if it's easier to mail, I don't really know.
Related to summer meals outreach, but separate from the yard signs, just Ashley, are there still magnets available? I've been getting a lot of requests lately as summer's getting closer.
Yes, we have budget probably between around 15,000 magnets. I think right now, the request we've received are about 2,000 overnight. So we can still take orders through that survey form.
Great, thanks.
Could you elaborate on the magnets? What does that look like?
We've been providing magnets to state agencies and other partner organizations that work directly with families that would utilize the program. So distributing them through WIC, Family Resource Centers, the Rocky Mountain Children's Hospital, Denver Children's Hospital, so various partner organizations like that.
Thank you.
Okay, does anyone have any other questions about the yard signs before I move into the next bullet point? Okay, well, we can add in, as we finalize, we can add in some of those comments about the actual final graphics. I'm adding in the text line, also looking at an older representative of an older student. Perfect. And then the other two bullet points, I also just wanted to capture everything that was talked about last time. So we're going to be meeting afterwards to talk through how the blueprint as a whole can support just general awareness of the summer meals program. So that could be through using the blueprint social media, Facebook and Twitter, and also looking at potential press release, any kind of media around that. I don't know if you have anything else to add yeah, okay. So we'll be working with the Blueprint team to also see how we can use those channels. And then lastly, which we'll go into here next, is talking about what we're doing as a group collectively to promote the summer meals program. So we started a tracking tool, which I'll go into in a minute, but I wanted to first invite a couple people in the room who have shared some of the action items they have initiated since our last meeting to support the summer meals program based on our conversations and idea sharing last time. So Naomi, do you want to share what CDPHE is doing?
All right, so after the last meeting, I was really excited to take a lot of the ideas that the group shared and share it internally with CDPHE. This is not an end-all list. We're still working on things, but we did accomplish a few things and close to accomplishing another item. The first one I'm really excited about is we met with our communication team, and they agreed to promote summer food service program on their main webpage for the whole month of May. And then in the future, we'll include a link where it leads to CDE's summer food service site through the summer. So I'm excited about that. We have promoted summer food service in the WIC program and child and adult care food program. For those of you who don't know, I work under the nutrition services branch, which includes WIC. So it's nice that WIC can help support promoting information about meals. And that includes letting them know they can order magnets to advertise or post them. For example, what we just shared with you, so they can order more. And that information went out to all daycare centers, adult care centers, family daycare home, WIC programs, and a local health department. And then the other thing we did is we started reaching out to local health departments such as Tri-County Health, and they're willing to promote on their website and Facebook page. And the last thing I want to share right now that we plan to do is share these magnets at the front desk, CDPHE's front desk. And yeah, we're just continuing our discussion, and I'm sure we'll come up with more ideas.
Thank you.
You're welcome.
Patty, did the information get relayed to you about, I know you just got back in town.
I saw it on the agenda just now.
Okay.
No, I didn't know.
No, we did. We did.
I'm sure Patty will be okay with that.
Yeah.
It's fine. So I'm Patty with the Family Resource Center Association, and we also started taking some action in how we can spread the word and kind of do some of the outreach with our 30 members. We have 30 family resource centers throughout the state that covers 45 counties in Colorado, and so we started brainstorming how we can kind of spread and promote the summer meal program. And so I'll pass it over to Jackie, who has been kind of leading this work within our organization, so she can give us a little more information on kind of the things we've taken on. And again, it's not all done. We're continuing to figure out ways that we can take action and utilize our network to promote this in all of our counties that we serve or that we have family resource centers in.
Hi, my name is Jackie. I'm with FRCA. So Patty and I partnered with our marketing coordinator. So we have an e-newsletter that goes out to all of our member centers as well as additional stakeholders, I believe every other week. So we committed to having the text and the banner for the summer meal program on all of our e-newsletters. This first one that we just sent out, we just did a preliminary, here's how you can get involved, here's some outreach tools, please reach out if you have any questions. And then we're going forward, start getting a little more specific. They can reach out to me if they have any specific, questions about what they could potentially do with summer meals, how to create some more outreach tools just for their center and what that looks like. And I know our marketing coordinator is totally on board for that, which was exciting. And then we've also partnered with our data manager to look into the robocall. We need to investigate a little bit further just in terms of, I know like privacy and what would be the best route to reach families. So reaching out to our member centers to see who would be comfortable with that, or if they want to do it on their own. So that's something that we're currently working on. And then we're also going to, Patty and I were just thinking about it, start putting this information on our website as well. So yeah, going forward, we'll see what this looks like. We just had our first meeting, but yeah, we're excited to share all this information with our network.
I also just wanted to add that we are going to have the banner and all the information throughout the e-newsletter all summer long. Again, we have an easier communication department that we can kind of just put it there for the whole summer. And then additionally, we convene all of our members every 3 months or kind of quarterly. And so our next one's in July. So we're thinking of how we can get some of the marketing materials taken for ease of, you know, kind of, we can say, please order them, but then if we have them there, it's easier for them to just take it. So we don't know how many we'll be ordering, but we'll be chatting about that. And then we're also hoping to add that information, same to the e-newsletter, on our website for the whole summer, and asking them to also do that, you know, same to on their website, e-newsletters that they all send out. So kind of spread it even further from our network. So we're excited.
I feel challenged. I think I need to go back to CDPHE and tell them you have to leave it on the homepage the whole summer. But they do plan on promoting it just in a smaller way the rest of the summer, but I'll be back.
Yeah, no. I know it's easier when you're not in the States and you have a smaller agency.
These are really amazing ideas, and as you guys were talking, I thought about two really important groups that maybe aren't even at the table, but we're connected with. So how do we get these posters in every county human services department would be one question. And how do we utilize our relationships to engage the early childhood councils to then become additionally allies in both their newsletters and their distribution and their website and their social media? And I don't have the answers to that, but I'm guessing there's some people in here that have really good relationships. But that might be, you know, since there's been some examples, being able to show them what other child surveying organizations are doing, how might we get those two groups engaged? Deborah, you might have some ideas, but certainly getting the county human services department to get those posters up would be huge.
Jennifer, to that note, we also reached out to Mary Alice Cohen with the Office of Early Childhood, and we are trying to get a scheduled meeting with her to try out how we can get the Office of Early Childhood involved and how we partner to kind of also promote some of this materials with all of their programming that they have. And I know that the Maternal Infant Early Childhood Home Visiting Program, who contracts with a lot of early childhood councils, we can kind of also promote it through there. So I'll reach out to Julie Becker, the director for the McVie program, and see if we can also partner with them and share some of the information and the marketing tools. So we can also, you know, tap into other early childhood mental health within the Office of Early Childhood. So we're hoping to get that scheduled soon. So we'll update that.
Trophies to give out. That's so many. We should mini trophies.
Yeah, like a ceremony in August.
Yeah.
Awards. Yeah.
Okay. I love all this conversation about getting the word out, because this is basically what Ashley and I dream about when we lay our heads down at night. But it is bringing up for me a conversation that I recently engaged with a friend who is not a school providing summer meals about how we market this. So as we talk about getting this message out across the community, I think it warrants some more conversation about what that message is. One of the obstacles that we have faced in Greeley is an ingrained notion that this is about kids on a free lunch application. And so years ago, we diverged from the classic marketing materials that we get for free from the from FNS and from the Department of Education. And we built in our own logo, which is it says kids eat free, and it's very colorful and it's block letters, and it appeals to secondary students. When we talk in our community in Greeley about kids eating summer meals, we try to focus on availability, access, and nutrition. And so we're really trying to hammer home the idea that no matter who you are, anywhere in the city of Greeley or Evans, if you're 18 and under, you can have access to a good, healthy choice in the middle of your day. It's been years, and we're still working, and we're still getting families who call and say, I don't get school meals. That's okay. It's summer. Between May 29th and August 9th, you can come to any one of our buildings and eat a nutritious meal. And that's the message that we use. And I don't know that it's a one-size-fits-all across the community of Colorado. I'm bringing it up only because so many of the marketing messages and materials align with a USDA child nutrition program. And because of that, there is this continued perception that we're talking about low-income families accessing meals through a child nutrition program, through a reimbursable nutrition program, which it is, but it's all kids, and all kids can eat free. Yeah. And so when we get those angry phone calls, you know, why are you feeding the whole community? There are kids out there that can afford to buy their lunch. Yeah, I don't want them buying Chick-fil-A, that's why. I'm feeding my whole community because I'm trying to improve the quality of life and the wellness for all of our students, all of them, regardless of their income status. And so I texted Jennifer, so it's already there, so it'll go on the list. But I'm curious to see if we engaged Workgroup 1 in a conversation and had them dive into some of these marketing materials, what their feedback would be to us about how we reach a greater populace with a message that all of these meals are nutritious and accessible to any Colorado, any child. I tell my families, if your cousins are visiting from out of state, guess what? They can eat for free. It's okay. So just want to put it out there for thought and conversation if there's any.
Yeah, Danielle, we were interested in something similar, and last year we were able to focus group just one group of high schoolers, so small end, but got feedback about, Rainey, what you mentioned, but a lot of the advertising was more for younger kids, but also that their feedback to us was to prioritize like the events. So like free, or like, you know, a basketball tournament with free lunch, not, hey, this is a free meal. And then there's also activities to work on the stigma piece of it a little, because they did have that association. And so I've shared that with CDE, but just prioritizing that this is more like a community building fun event where you can bring your friends and there will be activities. And oh, by the way, you also will get to eat for free, was what we heard from that student group, if that's helpful.
Yeah, this is Stephanie. So sorry for interrupting, but I have 2 comments / questions. First is, I know the governing council is going to review the document that you shared tomorrow, but in terms of like tracking and understanding like the breadth and the depth of organizations that are not necessarily just K through 12 or early childhood folks, I'm just wondering if there's going to be a space for that on the website, or where we can expect to kind of cover all grounds there. Has that been discussed already, or did I miss that? I apologize. And then I have a second piece after that.
Do you mean like libraries and churches? Is that what you mean by not school?
I think, yeah, sorry. I think I'm thinking of like the early childhood learning councils and some other folks that are part of the health equity advocacy cohort, just non-traditional organizations that have been mentioned. I'm thinking like folks in the disability community, folks in other communities that just aren't necessarily blatantly obvious, but that are part of our respective networks.
So one piece of outreach, targeted outreach that Hunger Free has done with that is with the migrant education program. I was able to present to the statewide migrant education program, and then a few of the 5 different regions about the summer meals program and the accessibility to anyone, and the documentation status. That was a big question. Isn't asked or required. There's no identifying information, but that's the only thing I can think of related to that.
I think my question was just more around where we can be helpful as, you know, as the children's campaign, in reaching out to folks that haven't already been contacted or, you know, have received that outreach. And so I'm just wondering if that list is available somewhere that we can populate to, or that we can make sure we're kind of capturing in terms of impact. But I just don't know if that's something that you all are sharing or that's posted on the website.
Yeah, that's a great question. So we created a Google Doc that was shared in the agenda email, I believe that Kevin had sent out, I think in this agenda meeting. Yeah, and so what we've tried to do is start capturing those so we can see our collective efforts, and also so we're not duplicating as well. So I would just recommend, as you start your outreach and you start, like, for example, the things that Naomi and Jackie and Patty mentioned, that we start tracking that in the Google Doc as best as we can, so we can see what everyone is doing, and then also be able to identify if there are gaps and that there are people that we should be talking to that we're not.
That's super helpful. Thank you. And then I think the second comment, and this is to just Danielle's point, one of the things that I think we're trying to continue to make the link between is, you know, food and health. And so to the perspective that we can speak to just like food is a necessary component of health, and framing the messaging that way as we're, you know, like doing outreach and as we're sharing with folks the importance of just having access to food. And regardless of what your background, economic status or socioeconomic status is, I think to the extent that we could frame it around health equity, I think that's just something that more folks around the state are starting to understand, and specifically the piece around like social determinants of health, and thinking about how that isn't an obvious thing, but how we can explicitly think about naming that and making that link for people and for communities.
I'm just going to jump in since I attend most of this, the work group meeting. So I think, you know, the great thing about being agile and right now is that we have this time limited opportunity to get people, to raise awareness in the communities, to try to get a jump start on just this summer's summer meal programs, and just make up some ground, while CDE and CDPHE and all the work groups start to really begin to plan out how do we, what's the midterm and long game for child nutrition programs. And that, I think, is going to be the work ahead. And this is really a stopgap measure that will help, you know, I'd love to see like a 10% increase in summer meals just through some of these efforts now. And work group 1 is putting forward to, you know, really basic proposals, and it does include, and the whole blueprint really is about hunger and its impact on health and community vitality and social determinants and health and mental health. And so that frame is going to be used, I think, in all of the work that we do, and most certainly in the public and political will building campaign. It's just that everything is kind of in motion at the same time. And again, there's some short-term gains that we can get that won't incorporate everything that we want, but then there's the long-term game where we will be really, you know, being able to be much more methodical in kind of how we roll this out.
I just want to add something to what Danielle said. It was a really important point. I wanted to add to what Danielle said, a really important point, and it's something that Chef Jess and I have talked about a lot when I was at LiveWell, which is a lot of funders have been really specific about funding low-income populations, and so that's where that messaging, a lot of that has come from. And I think there's going to have to be a period of reconditioning, and all means all type of thing. And I can let Jess, if you want to chime in and add to that, but I just know that that's been a huge problem, and it really makes it feel like we are targeting. We are obviously targeting low-income communities, and we have to, but I think that's where it really clashes with stigma, and I think there's got to be a better way. So I just wanted to commend that point and kind of have us think about that a little bit.
And I will chime in just on that, because we do see this just all around the state, and there's just issues even with school cafeterias and students not even wanting to eat the meals because of that perception that they are considered low income just by going into the cafeteria and actually participating. So it is, the more we can try to just get away from that and that whole perception of these are free meals, and it's more, especially along lines of what Taylor was saying, these are more community-focused events, and you just happen to get a free meal as well, and really trying to do more of that connection between nutrition and health, and try to get away from that low income piece, because kids are very perceptive, and they recognize that, and they are noticing and being very aware of each other and who's eating in the cafeteria or who's taking advantage of these meals. And especially as the kids get older and they're in the middle and the high schools, that could be the biggest reason why they aren't participating, is because they don't want to be stigmatized and associated with that. So it really is just, again, that reformulation of how we present these meals and how we really try to, again, just keep destigmatizing it, because it's becoming a bigger, more pressing concern than I think a lot of us realize. And that whole fact that the funders are so focused on only reaching districts that have 60% free and reduced or 50% free and reduced, it really makes it challenging for other districts that have plenty of students that are in need, and they're just barely on the line of even making it into that reduced category or that paid category. And we're really missing a big gap here by trying to focus on that. So it's good to keep bringing it up and talking about it.
Thank you. I agree. A really good conversation. It's going to lead really nicely into the next part of the meeting, looking at some of those longer term strategies that we can work up with on this group, and then also how we can partner with Workgroup 1 on those. So in looking at the time, I just wanted to wrap up the conversation around summer meals. Is everyone in consensus that we're okay to submit the governing council proposal tomorrow? Yeah, okay. Well, great. Well, then we will do that tomorrow and keep the group updated on our progress. And Danielle has alerted me that it's time to move. So we're going to do just a really quick, you guys know about this Chrome feature?
Well, now we do. This is, for those on the phone, if you zoom in, this is a Chrome extension called Move It. And if you download it and put it on your browser, and you leave your browser open, you can set the time for it to go off. Mine is set every 55 minutes. So every 55 minutes, and it locks your computer. It's like you can't touch anything. You can't do anything. You can't respond to an email until you clear this. So we have to jog in place for 15 seconds, or I can't.
Only if you want to.
So should someone want to lead this exercise? Oh,
I'm just going to stretch. All right.
Oh wait, I'm not moving.
Sometimes I get it's built for classrooms, so sometimes I get the do the wave in the whole classroom, and I'm by myself in my office.
I'll do what activity to do.
Yeah. Oh yeah. It says jog in place for 15 seconds. And I've never had the same one come up twice. Oh, that's fun.
Look at that. Interesting.
I hope everyone on the phone also jogs in place.
Those are healthy snacks. Yeah.
All right, so we're just going to move into the next half of the meeting, and I want to invite our evaluators that we've been working on at CDPHE for our needs assessment. That's part of the Colorado Health Foundation Blueprint Planning Grant that CDE is working on, that we received in September and goes to September of this year. So I will hand it over to Shannon and Abby.
Well, I'm Abby, and Shannon is passing out some materials that we'll be kind of going through and facilitating a conversation around. So Shannon and I are at CDPHE, and we sit within the Center for Health and Environmental Data within the evaluation branch. And we've been working with CDE since about December on planning these surveys and key informant interviews to kind of help really assess what the needs are of the SSAs and summer food programs.
So I'll just go over kind of just a brief overview. We did conduct 2 surveys. One was with the SFAs. Let me know, Carrie, chime in on acronyms. I'm assuming that everyone knows acronyms, but I don't totally know.
School Food Authority.
Okay, thank you. And so we conducted the surveys both in February and March. The first survey was kind of a more extensive one that went to the SFAs to ask about the breakfast, lunch, snacks, and summer food programs. We then did a second survey to the summer sponsors. So more, I guess, the community-based organizations that implement the summer food programs together. So the same information from them as well. We had an excellent response rate. I'm happy to say the SFA survey went up to a broader audience and we had an 88% response rate, which is amazing. I will say, doing surveys with all sorts of different groups around the state, getting an 88% response rate from this group was awesome. Also, the summer sponsor survey was a smaller group, and we still got a 63% response rate, which again was amazing. We have offered incentives, and so we're in the process right now of doing just a random selection of those that responded to the survey, since we now completed the key informant interviews as well, so that we can get those incentives out to the different SFAs and respondents for both the surveys and the key informant interviews. Shannon then just wrapped up the key informant interview portion of the needs assessment with 12 different SFA contacts, which Gabby, I think, participated in those as well. So today we're just really going to present some very high level results. There are many more questions in the survey for the different food programs, but we wanted to at least kind of give you a little something just to kind of wet the palate. So you can kind of see what's coming back from this data. As listening to your conversations already this morning, it's sounding like it'll probably resonate very well with what we're hearing. We've also summarized some of the key informant interview takeaways as well. And so we're going to facilitate a conversation around that. If you look at this first page, it just kind of has the bar charts on here. It has the response rates from the surveys that I already went through. Most of this is really from the SFA survey, and so you can see kind of the programs implemented. We asked them which programs they were implementing so we could kind of branch them out to answer different questions about those programs, or maybe why they weren't implementing those programs if it wasn't something that they selected. So this just kind of gives a very high level overview about those SFA respondents and what programs they're implementing, and then their interest in whether or not they want to expand to more sites within their SFAs, and interest in implementing new programs if they aren't currently implementing those programs. So I'm not going to go through and read all those percents, but that is there so you can kind of take a look at that. Okay, I'll let you.
Okay, so, but if you turn the sheet over to the back, you'll see these very data-rich tables. Again, it's very high-level data, but rather than either reading this off to you or having you spend time here looking at this, what we'd really like you to do is break out into 4 groups. And so that would be 3 groups inside this room, and we're going to ask each of you to take one of the tables and review it, and then report back to the entire group what this table says in summary, and that's so that we can more effectively kind of understand what the findings are from these 4 tables and share that back. So we're going to take 5 to 7 minutes.
If you want to count off in 3s in this room, and then you can break off and just go with that table that you have. So group 1 will have table 1. The group on the phone, Kevin is going to help us break them into their own group, and you guys will be table 4 you'll go over. So if we want to go around the room, Taylor, if you want to start with 1.
2, 3, 4.
Oh, 1. Sorry.
2, 3, 1, 2, 3, 1, 2, 3.
1, 2, 3.
We're not.
1, 2, 3. 1, 2, 3. Perfect.
Excellent. So if we want to, we'll break out, we'll have maybe group 1 go up in the front corner, group 2 can go back over in this corner, and then group 3 can go over here, and then Kevin will help set
group 4 kind of be in their own group on the phone. And then you want to
like you to do is to identify your primary takeaway from that particular table and, write it down if you need to, and be prepared to share that information back to the group. And the idea here is that you don't each have to read each of these tables. Each group is going to master one of these tables and then share that information with the entire group. So, so just be prepared to have one person report back to the group what the summary of the table is.
And Shannon and I will float around, so if there are questions or anything, we can help answer them. Oh.
Hey everyone, can you all hear me?
I
Hello?
can.
Yep.
Yep.
Cool. Great, I'm gonna go out into the lobby and then we'll be ready to go. Okay. So we're table 4, and I know you all don't have this document on hand, but I did share it on the screen, so you should be able to see it here. But yeah, does anyone want to get us started? Alex asked, what does the orange mean? I'm not sure about that. We'll have to check in with the rest of the group when we get back in.
Sorry, Kevin, this is
I'm
Steph.
gonna go.
I had to step away for a brief moment. Can you clarify what we're being asked to do? I'm so sorry.
So we are looking at table 4, which is the barriers to program implementation, and sharing some general thoughts. I was kind of away for that section too, so if someone else wants to fill in on the specific discussion questions, that would be great. I'm gonna go. What was the discussion question, sorry? Oh, okay.
That was it.
Cool. So we're just going to summarize the findings from that table and share it out with the rest of the group. So I'm going to zoom in on that now because I know it's kind of hard to see. The orange part is just that was the highest percentage for that table, highest total percentage.
So, do these numbers indicate that, are these just the top 3 or 4 in school breakfast program and after school snack program? And the ones that are blank, does it truly indicate that they did not receive any, or, there's no data there, or they were just removed?
So do these ones, so they're just kind of confused. So are these ones that are blank? Erica, thanks for your question. I have Abby here that can clarify, but the ones that are blank did not have any respondents?
Those just weren't, that was not one of the areas or one of the barriers that they responded to. Table 4 is a little bit more sparse because it's not as many folks implement kind of some of these different programs. And so really we're looking at the columns across is breakfast, the snack program, and then the summer food program. And so there was 2 different surveys for that summer food program. One survey that went out to the SFAs and then one that went out to community sponsors. And so these really are just kind of their high level results of what those barriers are to implementation, if they are already implementing that program. That makes sense. I can clarify more too.
And I just want to make sure that the after school snack program column, that's related to the after school snack program that is funded through the Department of Education, correct?
Correct. Yep.
Okay.
Yep. And the breakfast program. Yep. It's the breakfast program and the after school snack program. And then the summer food. Sorry, messing up my acronyms right now, but the other, the columns that has the 2 that are split, that's the summer food program. That all makes sense.
Yes, thank you.
Okay.
Yep.
So does anyone have any initial reactions or kind of further questions about that data?
So Jessica here. I'd say obviously it's in orange for a reason, but that kitchen staff time and capacity thing is interesting to me because I know it's a mix between kitchen staffs, and some of them really enjoy having the summer off, and then there's others who would like to be able to work throughout the entire school year and have a consistent income coming in. As many kitchen staff workers actually go and get a second job to supplement over the summer. So the staff time piece is interesting, and I'm sure there's plenty of sites out there that don't do anything over the summer because their staff maybe doesn't want to work over the summer and has chosen to work in a school district because of having those holidays off. And I wonder where they could start identifying the need in the community for people who would work over the summer, or if there's someone in their kitchen that wants to work over the summer and do it. That's just very interesting, the staff time piece.
I agree with you on that, just very recent experience, and I understand I come from a very large district, but, we only had 18 spots for summer food service work, hours, and we had 56 people that wanted to do it, and so, yeah, it's just a very different experience, and we had to, unfortunately, choose, and so.
I wonder, I know just with your district being within the city, it's probably going to be tougher in rural areas, but I wonder if there's neighboring districts that are having a hard time, getting staff who are interested in working over the summer, and if some districts are having a higher interest from their staff that want to work over the summer, how that would even work, if there'd be a way to have them go work with a neighboring school district over the summer if there's not the space in your district, because you've already filled those spots. I'm sure that's a much bigger challenge than as simple as, hey, go work for so-and-so district, but.
Exactly. I think, because the way this survey was administered, right, is one person per district. And so, the vast majority of the 180 school districts in Colorado are, under 1,000 kids. And so that means probably the pool of food service workers within there, are really under 10 in a lot of cases, right? So, so the proportion of people that are responding is very, very large, coming from a place where the pool is not large. So I think that's exactly it.
Yeah, and I wanted to point out something Alex put over the chat that some of you might have seen already, but she said, is it possible the kitchen staff time is really funding issues of funding staff for this over the summer? I know some WIC programs can't do things outside normal hours because they're required to have security. So I would take that to the rest of the group and say, could those also be factors that are at work here in your experiences?
I'm sure the funding's a big one.
It's funding, and I think in our case anyway, you look at the number of possible students that you're going to see, or kids that you're going to see, and can you fund the staff to that it takes to feed a small number of kids, and so I think security does play into it. I know that, we basically prioritize sites that have some of that infrastructure in place over the summer, whether it's programming that's already there, so that there are, those folks already built into that programming, so.
So this is Megan. I just wonder, with the kitchen staff time and capacity, how we can get creative to support these districts and schools ultimately. Just being connected with my colleagues across Douglas County, a lot of schools are starting to go down the path of offering vocational programs. I'm not wondering how we, and it's the collective we, can partner with vocational programs that have a culinary training program that we could figure out a way to offer summer internships, or it's part of a summer work program, because it might be, if it's truly funding and you have, a 16 or 17-year-old, their salary would be vastly different than, a food service worker who's been in the industry for 25 years. So I think being creative with the resources that could potentially be readily available.
Absolutely.
This is Diane at the Food Bank for Larimer County, and I guess I'm looking at it from a different perspective of being at the food bank and like us being a sponsor site, and kind of looking at that sponsor column of how like there aren't as many challenges. And I think like food banks are in a different unique position in that we do operate year round in it, so we don't have those same challenges. So, I mean, I think that's something in Larimer County, I think the food bank's offering more summer food sites than the school district. And so I don't know, I guess just looking at other places that could also, I mean, schools are obviously like have a lot of benefits of having sites there, but we're trying to, we're doing our mobile food truck this summer as well, and hopefully that goes well. But just looking at some other ways to serve the community if the school, there are so many barriers for school staff.
Hey all, this is Stephanie. I just have a quick question for the fourth row from the bottom. It says lack of summer school programming / activities, and the 31%. Can you clarify that stat, or can someone clarify, like, I just find it interesting where the very top one, 53%, say they don't see a need, but then there's also this stat of 31% lack of summer school programming / activities. Can somebody speak to that?
So I think from my perspective, from the district perspective, and I'm not sure if I'm answering your question, so if not, let me know. But I think when you're deciding to do summer sites and how many to do in a school district, you really are looking for those built-in activities that are already there. So you have that consistent population that is already there, and you also have school staff support there as well. So I think it's in reference to that built-in population that school districts look for when they're deciding if to do a site.
Got it. That's super helpful. Thank you.
Absolutely.
This is Kirsten. Sorry.
Go ahead, Kirsten.
I was going to say, I also thought I think the perspective you just shared was really interesting, because when I looked at the data, the thing that I was the most surprised by was the difference in programming for after-school snack and summer meals. I was surprised that the summer meals percentage was higher, seeing as activities aren't required for summer meals, but they are required for after school. But I guess with the explanation that school districts really look to those programs before they decide if they're running them, maybe it's that there are just more after-school programs already happening, so it's not as much of a barrier. It's just they already exist.
And that's exactly it.
Great. Thank you, everyone, for the discussion. We have about 1 minute left, but I'm just wondering if we have any volunteers for sharing back to the group, just kind of our general thoughts. Anyone?
I mean, I'm happy to.
Okay. Thank you, Erica. That was Erica, right?
Yeah, it is.
Okay. Thank you.
So what, I guess my thoughts on reporting out would be the surprises were the kitchen staff time and capacity for summer food service especially, And that we are, guessing that varies drastically between school districts based on size and location. And just the perspective on the programming needs for a district to make the decision. What are everybody else's thoughts that should be shared?
Yeah, thank you, Erica, for sharing. And I will say, I was just out in a rural school district and thought it was pretty interesting, but they are not allowed to only have one person in their kitchen. They must always have 2 people at all times. So I could see how that could be a reason why, if they have a small, population for summer and really only need 1 staff, but the HR policy that you must always have 2 people on staff can be a bit of a burden for a school district if they're not bringing enough money in. So I think that's interesting.
Okay, so we're going to rejoin the rest of the group.
Student participation and also challenges to increasing student participation. And the number 1 factor in increasing participation was improved meal quality, which we talked about may mean different things to different people. So we were chatting about that. And we also were surprised for the biggest challenges to increasing student participation. They were different based on breakfast or lunch, but we were surprised that timing didn't affect lunch, since all of us have had a lot of feedback that students don't have a lot of time to eat. So that was interesting. And we also were interested in the student involvement for menu development, and wondering if there was, we don't have to talk about it now, but just thinking about, does that affect the stigma, and also does that change meal quality? So in summary, the best factor to increase was improved meal quality, and the biggest challenge for breakfast was alternative options, and the biggest challenge for lunch was student stigma or negative attitudes towards school's meals.
Great, thank you. So I do want to clarify one point, and that is the way these questions were asked on the survey is that we gave every respondent the option to give us their top 3 challenges. So timing may have been an issue for lunch. It just wasn't one of the top 3 issues that rose to the top. It just may have been, it could have been number 4. And we didn't put the data in there because we wanted to just focus on the top 3. So just that point of clarification, but thank you for that share out. Group 2. Do we have a French person?
Yes, Ashley. So for table 2, really the bigger takeaways were that the most effective factors for increasing participation, both our school food authorities and community-based sponsors, their top factor was coordinating the program with other summer activities or programs. And then we looked at biggest challenges to increasing student participation, and there were 3 factors that tied for the school food authorities, and they were different than the top 3 challenges for our community-based sponsors.
Okay, so just a quick recap. Table 1 was looking at kind of those facilitators and barriers to student participation for just breakfast and lunch. And table 2 was looking at those same facilitators and barriers to student participation for the summer food service program. And it was, that data was collected in 2 separate surveys. So we had we wanted to look at those SFAs versus the summer sponsors that may have been non-schools. And what we found, and you'll see as we report out for the next 2 tables, that often those 2 groups have differing priorities or differing challenges. So for table 3, who's our reporter? Danielle, you've been nominated.
I think I just got nominated. So we looked at the barriers for expanding 3 programs: summer meals, breakfast, and after-school snack. Well, maybe this isn't obvious, but just to clarify, school food authorities don't all operate breakfast programs. non-school food authorities, so organizations offering child nutrition programs that are not school food authorities, do offer after-school snack, but it is not captured here. This is an after-school snack program that is reimbursed through CDE, not CDPHE. So the difference there is this is so acronym laden. After-school snack looked at school food authorities, not CACFP offered at nonprofits and community partners. So with that qualifier, the biggest challenges to operating or expanding into more school breakfast programs, really you have three kind of almost equal barriers. Student eligibility, so the reimbursement, there aren't enough students meeting the eligibility requirement that the reimbursement is high enough. Transportation and arrival time and student and faculty support tie. For anybody that has ever worked in a school district, you learn really quickly that you're competing for instructional time. I heard yesterday a school district superintendent quipping about just adding 15 minutes to the day. Oh, if only. So those, staff, faculty, they want time with their kids to teach them how to read and do math and science. And the bus drivers want to get them there in a timely fashion, and we're competing with that to offer school breakfast. So those are the three really big barriers. After school snack, overwhelmingly, the largest barrier is the opportunity for after school programming. If there is not an after school activity, after school snack is not offered. It's as simple as that. Beyond that, the program eligibility and the low reimbursement are equal barriers. Just doesn't make the program financially responsible. I believe we're at 86 cents this year per snack. And if you have 10 kids participating in an after-school reading program, that $8.60 doesn't really make it worthwhile. 91.
I just have a quick question about that, though. Is it true that any program happening in the school allows any kid to actually get the after-school snack? So they don't actually have to be in the reading program, but if you have a reading program and 100 kids wanted it, but only 10 participate, 100 could get it and get reimbursed.
Absolutely true.
Okay.
The challenge with that is the second the bell rings, the kids run outside and get on a bus.
Yep.
So they're not in the building. They could access it if they were. But the majority of our after-school snack programs operate because a teacher has a program for kids to stay after school and have some sort of activity. The rest of the kids leave the building. So it turns out they don't like staying after the bell rings. I don't. Can we do that? I'm kidding. We can't. We sure can't do that. Just like I can't hand out stack lunches for summer.
Activity and there was a 5-minute gap between,
Transportation didn't show up as a barrier for after-school snacks, but I guarantee it would if we were putting them on the bus. They don't like it when there's food on the bus. And then we looked at the summer food service program, and this, like the previous table, is broken out into sponsors and school food authorities. Almost half of the sponsors said, yeah, they don't have any challenges. They're doing just fine. And then 20% or 18% said their biggest barrier was school district. And I joked about that because I feel like that number should be 81. I think somebody was dyslexic on that number. So in my previous life as a food banker, I can say that the challenge there is that school food authorities get first right of refusal for almost any area eligible location to offer summer meals. And so if you're a nonprofit community partner wanting to operate a summer meals program, you kind of have to play nice with the school district and find out first if they have first dibs on that site. So I can see where that 18% comes from, and I'm pleasantly surprised it's not higher. In regards to summer meals being offered through school food authorities, Erica, you are highlighted. It's like you knew I was going to call on you. I would love for you to maybe chime in about, if you're willing and comfortable, just about sort of the budgetary constraints that you and I have shared with each other. It really does come down to the bottom line at the end of the day.
Absolutely.
You're not on mute if you want to talk.
No, absolutely, and I think we discussed similar items in our group as well, and so, it really comes down to, I think you need to have a number of students that are in the program and ready to eat in order to, justify the staff time and the money that it takes to pay that staff. So we talked a lot about, that's why as a school district, you are looking for already in place activities so that you have a population there that will be serviced. So to justify that. Is that what you're asking?
Yeah, that's it. That's exactly it. I want to just share with the group briefly what happened in Greeley last year. We increased our summer meal service by over 50%. The summer of 2017, we served 50,000 summer meals. The summer of 2018, we served 76,000. That said, our labor budget for the summer of 2018 was more than 3 times the total reimbursement that we received, and absolutely crushed our fund balance. So if I can assign numbers to this for you that are mathematically minded, our reimbursement was 6 digits, our labor budget was 7, just for that time period. So it really is a business challenge that we're facing.
And, with that said, as we were talking through, the largest barrier to program implementation is the kitchen staff time and capacity. But I think some of that is the budget availability for that kitchen staff to justify and deciding if the meal served justifies that. And Jessica brought up that, she just had an experience in a rural district where it may be a small number of students and we want to feed that small number of students, but, policy is that there are 2 staff members in the kitchen at all times. And so the reimbursement from that small number of meals may not, add up to anywhere close to the payment of 2 staff members. So.
Erica, you just touched on this a little bit, but you might be able to expound on it a little more. Is that challenge the same in school lunch, or it's more in summer because the operational costs are higher, the reimbursement's less, participation's lower, or?
So certainly we're struggling with our budgets during the school year as well. The reimbursement in summer is actually more. It has just topped $4 this summer, which we're all a little bit giddy about. But what we are seeing, at least in Colorado, and I think that this is definitely true if you live on either coast, is a really dramatic increase in what we're paying our teams, and nowhere near that increase in the reimbursement. So reimbursements may go up 2 to 4 cents annually. In the 4 years that I've been in Greeley, we have increased our labor budget 44%. In 4 years. Wow. And largely that is due to the fact that school nutrition professionals are probably the most underpaid, not to mention, underloved group of professionals. And so 4 years ago, we were entry level was $8.50 an hour. And, we're now looking at an $11.90, I think, is minimum wage January 1st, right? And it's still $11.90. I don't know how you live on that. So it's not a matter of, I'm not making a quality statement about that. It's just a factual statement on what happens to our labor budgets. I will, just for the sake of the group, I'll throw out that we've calculated for school food authorities that somewhere around 80 reimbursable lunches and obviously that's going to be different based on your own labor budgets and your own overhead, but somewhere around 80 reimbursable lunches is the break-even point.
I had a question, if I could, about the student eligibility free and reduced percentage being too low for the school breakfast program. And Gabby and I have talked about this a little bit. Is that not enough families who would be eligible are turning in applications, or there aren't enough eligible families in the district and so percentages are too low? Does that make sense, what I'm asking?
Hey, I think, Erica, you would be better suited to field that from a district with a lower free and reduced percentage.
And I'm not sure how this, I can't remember how this question was posed, but I think what you're getting at is just that, you know, with lunch, because of the time of day, right, you are going to get those who qualify and who don't are coming to your cafeteria at that time with their class. And so then a larger number of every eligibility might choose to have school lunch. But with breakfast, you know, either their parents are not, if they don't qualify and they're not going to get a free breakfast, then the likelihood of a parent bringing their child to school in time to receive that breakfast or transportation arriving at the time to get that breakfast, they're just more logistical things. And so it's less likely that a family is going to choose to do that. So I think it's more about that than it is the technicality that, you know, you can make breakfast available to anybody, but it's more likely that students who qualify are going to take you up, you know, take advantage of that service. So I'm not sure how it was posed, and there may be a question, you know, around the breakfast after the bell legislation that requires universal free breakfast to schools that have more than 70% that qualify. It may have been an understanding of saying that their free and reduced percentages are too low to have that program required. So I'm not sure, again, how it was posed, but I think it's just more about who uses that service if they are not qualifying for free and reduced meals. Does that make sense? Is that what you're asking?
And the key, yeah, I think that, I mean, that is, I don't know if you have a better answer, but I wanted to point out too, for that question, it was about site expansion. So that may be a little bit of a nuanced difference about this question was asking people who don't currently offer breakfast, why they're not. What are the biggest barriers of why they're not adding another breakfast program? I think under barriers to student participation in breakfast, I thought there was something around actually students, families filling out the meal application. But so there was a little bit of a nuance between how that affects, the free and reduced percentage affects program participation and also the decision to add additional programs.
Gotcha. And I wasn't looking at that closely. So I think it's probably, I think from a district perspective, when you're deciding to expand a site, you are looking at what your projected or your participation is going to be at that site. And if you do not, you know, again, it's kind of justifying based on what your participation might be. And at a school where free and reduced eligibility is very, very low, you don't necessarily expect your participation to be there.
Yeah, so just to kind of drive that home, the paid reimbursement for breakfast is 31 cents. If you are in a high free and reduced district and you're meeting all of your points, the free reimbursement for breakfast is $2.14. So the difference between $2.14 and 31 cents You gotta have a lot of kids to participate at the free rate in order to justify the staff time and labor, especially when you then start to look at the overall day and what you do with that staff between the time they feed the kids, let's say it's at 7:30, and the time they get that lunch ready. There's some hours in there, and so when you expand it to breakfast, it's not just a matter of providing service, it's a matter of now you're providing benefits for that employee because now they're working more than the minimum, which on average is 4 hours. So it really does get deeper and deeper into the cost.
Great. Well, let's move on to group 4, online.
Okay, we were looking at barriers to implementation of breakfast, snack, and summer food service, and the most consistent barrier that showed up in breakfast, snack, and summer food service for the district side was kitchen staff time and capacity. And so I think from the breakfast and snack perspective, we've talked about this previously, and it again goes down to the budget and the justification of can we, is the participation there enough to justify or to be able to pay the staff to be there. In summer food service, we were a little bit more surprised by that being one of the biggest barriers, but I think it varies pretty drastically from a greater Denver larger district to a smaller rural district, whereas, finding staff who are wanting to work the summer food service program, that has not been a barrier. In a larger district, we've had to turn people away, certainly, but in a smaller district, I think, that obviously is going to be very, very different. And again, then it plays in of how many staff you have based on, compared to your participation as well. And then we looked at, and we had the discussion about moving into summer food service. The next barrier really was the lack of summer programming. And again, it's not a requirement of summer food service, but when a district is looking to decide upon a site, you really are looking for that population to be there to have the most successful site. So that was clarified, and again, it came up in snack as well, but to a lesser extent. But again, it's required in snack program. However, there are more of them that are occurring, I think, to tap into. I think, again, similar to site expansion above, on the sponsor side, there's a significant amount that they aren't seeing those challenges. So I think we talked a lot about, again, those sponsors supporting in areas where the school district is not finding a way to be able to conduct that program. So yeah, that's what we saw.
Great. Well, thank you for that summary. So I think we learned a lot about the tables that we presented, and I will say that this is a drop in the bucket in terms of the data that we have available. And this is, again, at a very high level. I think you can see here, particularly in these last two tables around barriers, that different programs and even different administrators of different programs are finding that they don't have a lot of commonalities in those challenges. So that really speaks to needing to customize and really address the programs differently, potentially. But the next thing I wanted to do, just very quickly, you have this written up, it's your third page, you don't have to look at it now. I'm just going to give you some very high-level highlights. I conducted 12 interviews, key informant interviews with food services directors, both from FSAs and a couple of summer sponsors. And we had some interesting drill downs to some of their responses, and we found out a few interesting things that I wanted to share. First of all, above and beyond all of this, I was very pleased to say that, you know, every individual I spoke to was very passionate about their job, about the work they were doing, and so that really resonated in some of their responses. The first thing that was really kind of a common theme through all of these interviews was that meals have changed, but parental attitudes have not. There was a lot of, you know, this is not your mother's cafeteria food. And so we did have a lot of conversations about meal quality. Somebody said something about, well, it depends on what you mean by meal quality. We asked them that question, what does meal quality mean to you? And pretty consistently, they said that it was, you know, it has a high nutritional value, and there was a lot of discussion about scratch cooking and quality ingredients and, you know, good tasting food, but that they really wanted to make sure that kids were fed. But the biggest challenge by far was this kind of parental stigma around what school meals are. At the same time, programs were implementing some very innovative approaches to delivering those meals. So they were doing a lot of the hard work around trying to get students involved in making decisions around food, doing taste tests. There was, and this varied a lot. Some food services directors had much more capacity to do this than others. But there were, you know, a la carte or food court models. There was some grab and go. There were small food carts brought outside of the cafeteria, so kids didn't have to go into the cafeteria. Somebody talked, there were summer food trucks. So these kinds of innovative approaches were pretty widespread, not necessarily consistent, but widespread. Also, food service directors and their staff, this is a big one, have very limited capacity. That was kind of a good takeaway from that last table that we talked about. We did hear often in rural districts that, you know, you can give me all the money you want, I can't hire people. There's nobody here who wants to work in the summer. We did find that food service directors were more inclined to put their effort and energy, because it was so limited, into those programs for which they had more control. They had more control, they had a captive audience. That was really lunch, and to a certain extent breakfast. They were a little concerned about some of the other programs. They had either, if they had experience, they had some successes and failures. They really struggled with collecting data on breakfast. They didn't know why kids didn't participate. I don't know if the parents are feeding them. I don't know if it's a timing issue. You know, there was typically more success with breakfast after the bell or universal offering of meals regardless of the program. And I will say that we did ask about 4-day school weeks and kind of food outside of school. And for the most part, with few exceptions, there was little focus on that. Our community partners are providing that food. We work for 4 days. We don't work on the 5th day, you know, and it wasn't that they weren't passionate about feeding kids. It was very much that these are the limitations that we have, period. It's not on our radar. We know that work is happening in the community. Different food services directors had different knowledge levels about the work that was happening on that 5th day. And some of that was tied to the newness of their position. If they were a member of the community, but, you know, if they were new to their position, if they were not a longstanding member of the community, they might not know those relationships yet. It was on their radar. And then we saw that where they had some capacity to put in a little extra effort, they were really focused on or aware of the need to secure additional resources. Resources was a big problem. They needed grant money. They have aging infrastructure. They have increased food service staff costs. So they were really trying to figure out how to manage that bottom line, and so they needed grant money. We did hear from one person whose community had actually in statute determined that all students would eat regardless of the cost, and they were really struggling with that budget and kind of paying for it in the long run. And we know, and none of this is going to be surprising probably to the people in this room, but food service directors at smaller districts often wear multiple hats. They're often in the kitchen. They barely can get through some of the administrative work here, and they just don't have the time and energy and resources to do some of these, to expand their programs. One thing that was, I think, a little surprising for us and for possibly the CDE was that there was limited or little interest in specific training needs topically. There was a lot of strong opinions about how training was delivered. They want in-person training, not too far. They want training that occurs during food service hours, which is about 6 a.m. to 2 p.m. They don't want to have to drive far. One thing that was really interesting is there was, particularly in rural areas, there was interest in regional trainings or regional gatherings. And what was particularly interesting about that, and I'll talk about that in my next point, is that they really wanted to connect with each other. They wanted, for those who had an interest, and I will say that as much as they wanted in-person training, they saw the value in recorded webinars, but they wanted those to be able to access those webinars live so that they could answer questions. Or ask questions that could be answered. But there was a high value on networking, and that'll play out a little bit further. There were some, particularly I think it was the charter co-ops, who really wanted small chunks, easy to access modules online that they could share with those people that they were providing trainings to. But in the end, when it came to training, they really said that there were some other things that CDE could be doing to help them. And the big thing there was facilitating the relationships among themselves, so connecting those rural partners in the same region. They really wanted more collaboration there. One person gave the example of, I want to institute this software, I can't afford the license. But if a group of us got together, we could leverage and kind of secure this license as a group. So there was interest in working together. Many people talk about the disconnect between nutritional programs and school leadership, and that they very much empathized and understood that there were performance priorities among school leaders, but that nutritional staff were often kind of an afterthought, and they really were concerned that there was some legitimate evidence around the value of timing, allowing enough time for food, along with, good nutrition and exercise to enhance student performance and behavior in the classroom, but they felt like nobody was listening to them. And so they really felt that CDE could act as an informational authority with school leadership and really partner internally to get this message to school leaders that yes, you do need to focus on good nutrition and allow your students enough time to eat so that they can be high performers in the classroom. The other interesting thing was that wellness policies are often in place but not largely implemented or not largely known. I had one interviewee tell me that yes, we have a brand new wellness policy. It's great. Aside from the 3 school leaders who contributed to that policy, I doubt anybody else knows about it. So that was interesting. So again, just that kind of facilitating that disconnect between school food authorities and school leadership could be a good opportunity gap for the CDE or this group to fill. We also, and I will say that this is an unexpected discovery because it wasn't on my interview protocol. I wasn't looking for it. It may not come as a surprise to you all, but sustainability around institutional knowledge was a big concern. And that was particularly among districts where either the SFAs or their kitchen staff often combined were ready for retirement and they had no succession plan. I spoke to a handful of brand new school food authorities who really were coming in often from outside the community, outside the district, outside of school nutrition, and they were coming in from a professional industry. They were coming in from the restaurant world. They had great ideas, but they didn't necessarily know how to navigate the school world, and they wanted two things. They wanted one-on-one coaching and mentoring, and they wanted a very specific long-term roadmap. Not just how to get started, but really like, what do I do in year one? What do I do in year two? What do I do in year three? Because clearly they didn't have a capacity to do everything at once. They had a lot of needs. I want to connect with the community. I want to connect with parents. I want to do this taste testing. I'm just getting my ducks in a row and trying to figure out this world. So they wanted that roadmap. So there was also that opportunity there for, again, this group or the CDE to provide some support in those areas. That being said, I went through that really, really fast because I'm trying to be cognizant of time. I wanted to, with all of that information, ask you kind of one simple, really question. Does any of this resonate with your knowledge about kind of school nutrition program or your experience with them? And where are the disconnects? Where did you find something surprising? Or where does the data not reflect your own experience? Go for it.
I don't know if anyone has seen, USDA recently published, and I believe it's public. If it is, I'll send it to Carrie and you can include it in the notes, but a study is called the Meal Costing Study, and it's this huge, giant, long thing. But a lot of what they found is directly in sync with this. And so, like I said, I believe it's public, and so I'll share that with you. That way, people have data. You know, it talks about since Healthy Hunger Free Take Back, the quality of the nutrition in the meals has improved by, you know, these percentage points, and the cost of also producing those meals has also gone up for the requirements of fruits and vegetables, and the choice that a lot of districts that we love are making to use fresh, which is more expensive. So it's totally in sync with a lot of what this is, and that way, for those of you that work at districts that might be getting pushback about not having a big enough budget, or you know, why your costs are going up, it provides some data on why that's happening, and it might help you get some administrators that are not so on board.
It is public.
It is, okay.
It has the dollar bill image on like the.
Yeah, I thought it was on our website.
I thought
but
it
wasn't
was
sure.
in one of my tabs.
Okay, so I'll send you the link, Carrie. There's a lot of data. There's a really nice like 30-page summary that has some charts and stuff that, but I'll send it all to you to share out. Thank you.
So DPS did they had a focus group. They hired a company to do focus groups with parents, and just a couple things that really mirrored what we found here was that the parent perspective is really interesting. All these changes have been made, but parents don't know about them. So that was front and center, especially among Spanish-speaking parents. So it really made me wonder about the language barrier in the materials that we provide. The other thing was that universal breakfast, even if parents didn't have their students participate in it, was really seen and valued as a positive. So that was another kind of interesting point. In my work with Live Well, we often saw this kind of organic thing happen where food service directors supported each other and mentored each other. And Gabby and I often talked about starting a mentorship program, and I think the CD has done some of that. But it seemed like there was really great value in like the Dan Sharp taking on the Shannon and Ray, and now Shannon's going to take on somebody else. And there was just great value in that one-to-one kind of support. So this regional idea where people network and find each other, I think is really valuable. And then again, the disconnect with leadership is always talked about. The message of health is just not resonating with our leaders. It's just not landing on them as an important feature of this program. And lastly, it was very interesting to me in the focus group, the parents, which I will say of affluence, were very clever in that they had really thought about how their student could maximize time to eat. Even if they brought their own lunch, they knew that if their student's lunch bag was at the bottom of the basket, they would still have more time to eat than kids who took a lunch. And parents also knew that their student would have the ability to eat the leftover food, whereas if they purchased lunch, they wouldn't be able to eat anything later that they had purchased. So for me, this time to eat was kind of a hidden issue, and we heard it through these parents, and I just see that as a really huge equity issue. So stigma, alive and well, parents strategic and thinking about how to maximize opportunity for their students really drives home this importance of equity. Thank you.
Yeah.
First of all, I want to apologize for not hearing most of what was said in the last 10 minutes. I had my little earbud in. I was listening to the testimony. House Bill 1171 passes. And big shout out to Senator Priola, Senator Fields, and Representative Daphne Michelson-Janae for championing this effort. And I'm pleased as punch. We have full copay covered for students PK through 12 in the state of Colorado. Nice work, everybody. Thank you.
And no more GoFund.
No. Be nice to the school food service director in Durango. Her job is hard.
Any other thoughts about whether or not the data, any of these data from the survey or from the key informant interviews really resonated, or if you felt that anything was really off? Anyone online?
I just want to put one thing in. I do training for the schools just on USDA foods, and we found that the webinars work out really well, but you were talking about the really short modules, and we're actually talking about doing 5-minute YouTube videos on how to do a certain thing in our program. So that really resonated with me.
And I will say that in the interviews, they did say they really like the USDA trainings. And that's why they were like, well, we don't really need, we're doing that. We don't really need anything else, you know. But that's not entirely true. They wanted help with marketing, stigma reduction, and I think I put it on here. And then some of these other things. There were a few topical areas that were important to them. They just didn't rise really high as universal across all programs. Any other thoughts? Okay. So I have two questions for you, and I'm going to ask them together. Because we have 5 minutes left, and I want to respect that. But so the first question is, you know, what additional information would you need from us to help make recommendations to move forward with this information? And aligned with that is what do these mean? I mean, was there anything that you can what does this mean for the work group? What do these findings mean for your individual programs if you're actually administering a program? And then what else do you need to kind of make any decisions? We're all good.
On a more technical aspect, certainly from a foundation standpoint, we have attempted to have an emphasis in rural and frontier areas. So having a breakout of an understanding of where these respondents are coming from would be helpful. I'm not exactly sure how it would look once you did that, if you did it, but I know some of the challenges faced are different. And so sometimes looking at an entire group doesn't give you the same information. There are other cuts. I know there's plenty of evaluation people in the room, but that's one that stands out for us, is really wanting to understand really urban, rural, and then the blend in between. Some districts have a little bit of both, but that would be helpful.
We're working on that right now, and that is, we're actually looking at slicing and dicing that in a couple of different ways. With the first being the urban-rural frontier breakdown, and then I think we're looking at some kind of quadrant approach, possibly to see if groupings make any sense. But that is definitely on the radar. It's happening as we speak. Any other particular breakdowns that you think would be helpful to understand these data? Hand it back to Ed. Okay.
So next up, we are still diving into this data. There is a lot of data. So this is really just a high level piece. And so we're working with CDE to kind of first drafting kind of all of the results and then kind of culminate an overall report and some recommendations, which we are happy to bring back to this work group when that is completed. We're anticipating the final report to be done in June. And we can discuss any other pieces or data points at that point. So that's all I have. Any questions?
I just wanted to say this has been a really big effort. So big thanks to CDPHE and CDE, and this is something that's been in the works for a long time. And, really thank you all for listening and participating.
All right. Well, thank you so much for a great discussion today, and really excited about all the summer outreach that we're talking about and moving forward with. I will be presenting the proposal to the Governing Council tomorrow, so we'll just keep you updated and keep moving forward quickly because summer is approaching. So feel free again to reach out to me if you have any follow-up questions or agenda items, even based off this conversation today that you think of. I'm happy to talk through any of those. Otherwise, I think we're all set. So thanks so much, and we'll see you in a month. Unless, Kevin, do you have any blueprint items, evaluations?
Not really. I mean, we'll send out everything that we talked about today, like these documents, the ones that Megan mentioned in the follow-up email that will come likely next week. And otherwise, the last sheet in your packets is an evaluation form, and our team and Carrie would love to hear your feedback on if you have any ideas for how the work group meetings could go better or anything like that, any suggestions. So we would love to get those back. You can turn them into me. Thanks.
And one final plug for the Google tracking sheet for the summer outreach. We'd love to start putting that in there so we can see what we're all doing. So, thank you.